Hello, my name is Dr. Emma Doris. I'm a biomedical scientist based in the School of Medicine in University College Dublin. I'm also the founder of one of the largest public and patient involvement communities in Ireland called the Patient Voice in Arthritis Research. Although my primary research is in rheumatic disease, I also have extensive experience in public involvement in other areas and indeed even outside the healthcare setting. So I'm frequently asked to speak or to train other researchers, and this is always one of the first slides I use. So the public fund research in the hope it will improve the public good. Fundamentally, can you really improve the public good if you don't account for the public experience? The reason I have this as one of my early slides when I'm training people is that I think too often researchers distance themselves from their social responsibilities. And it is always helpful to remind them that by accepting public money, which is how most academic research is funded, they're also accepting the accountability that accompanies that funding. So this is one of my favorite quotes that I use, and it's a quote from the Royal Society's report on public understanding of science. So originally it was actually aimed at demonstrating how better understanding by the public of science would be positive and help them to make better decisions. But it also works the other way around, that broader understanding of the context that research is used in can actually improve the research. So decisions made in the light of an adequate understanding of the issues are likely to be better than decisions made in the absence of such understanding. And I think that's a really important quote that sums up the importance of patient involvement in health research. And this quote is from 1985. So we're not talking about new theories here when we think about things like public involvement. Indeed, I suppose public involvement in the policy arena really started to gain traction in the late 60s. It's taken significantly longer in the healthcare setting and particularly in health research, but a lot of the same issues and challenges that were brought to light in the policy sphere in the late 90s is what we're seeing again. And you do have to question how much we've actually learned. And I suppose that's one of the big focuses of this presentation, is really to kind of give you some of the lessons that I've learned, and in the hope that we don't just talk about public involvement, that we can actually overcome some of those hurdles and really embed it and implement it to make research better and make research more relevant to patients. So a big query I often get from researchers is, well, I work in a lab, or there's really no way that I can have patients involved. It's just not appropriate to have patients involved in my research. So if we look at this slide here, it is essentially a researcher journey, right from the idea to the close. Now the bit I've highlighted here, this is the only bit where it may not be appropriate to have patient involvement. It's the actual when you're carrying out some of the methodology. And yes, there may be a strong degrees of technical expertise that it's not appropriate to involve patients in. Not always, but often. But every other aspect of that is still an aspect of research. So from the idea generation to the proposal to winning to governance to oversight to impacts and outputs and close, there is absolutely no reason why patient involvement can't be embedded in those aspects and can't help improve those aspects of research. So, public and patient involvement. This is a slide I tend to use for researchers as opposed to when I'm talking to patients, but I think I'm just using it as a demonstration of how I try and get them to change their mindset. It's not about unleashing the public or patients actually into your laboratory. What it's about is increasing the relevance of your research, cooperating with people living with disease, just to make your study design better and more deliberate, to actually have an impact, to have an impact in the lives of those people. And that's really what it's all about. Again, I'm from a rheumatology background. I don't live with rheumatic disease. So there are many aspects of it that I simply cannot understand from reading the literature. The only way I can understand that is by actively cooperating with people who have that information, that knowledge that I don't have. And that's really part of the drive that I have to involve the public in my research is that it is simply good practice in science. And this is an area that falls under what's known as responsible behaviors in science or responsible research and innovation. So, another question I often get from researchers, should we involve the public in our research? Fundamentally, is it something that should be done? Well, I always ask them, is your research funded by the public? Which most of it is, whether it's through charity or taxation or through our national funding bodies or the EU, it is generally funded by the public. In which case, we actually have a duty to be accountable and transparent with how we spend public money. And if you can't show that you have taken in as much information and knowledge to make your research as relevant and as impactful as possible, can you really say that's a good use of funding? Another, I suppose, mindset that needs to be changed for some researchers is that sometimes it's nearly seen as a way to be benevolent to patients or benevolent to the public by allowing them into your research. And that's really not the best way to look at it. It's not about opening your ivory tower to allow people in. It's really about it being best practice and helping to improve your research. Fundamentally, if you are a researcher, you should want that research to be as relevant, as good, and as rigorous and responsible as possible. So PPI is one of the ways that you can increase the relevance and the impact of the research. So again, people get confused about where we can actually involve patient research partners during the research cycle in a way that will actually be, and this is core to everything I talk about, it will actually be an improvement upon your research. It will make your research better. So I'm not going to go through all of this, but really throughout the entire research cycle. You don't need to perhaps do it for every step, but there is ways of tapping knowledge that you as a researcher do not have in the patient community that can help improve research. So the reason I'm really putting this up here, I mean, a lot of you will know this, that you can bring this benefit to it, but sometimes the researchers don't. And you might need to remind them of that, remind them that their design of the research, especially if they're using patients, can really be helped, that if you actually have a patient there are design issues that can be so easily overlooked unless you actually involve patients in that design. So it's, I suppose, part of this talk today is that I'm trying to show you that you sometimes need to have a loud voice because there are many things that researchers will overlook or just haven't thought about. So sometimes you might need to remind them of it. So I'm just going to talk about some of the facilitators of PPI in Ireland, because there's been a big surge in public and patient involvement in Ireland over the last number of years, and it's by design that this has happened. It's not just accidental. So our national health researcher, which is called the Health Research Board of Ireland, or the HRB, they developed a pathway towards having more patient-centered research and having more public involvement in research. So this was their schematic of how they decided to embed public and patient involvement. So for all applications for healthcare funding, healthcare research funding in 2014, they simply added a question about how are you going to involve the public in your research. At that stage, it wasn't graded. It was really just to get people to start thinking about it. So they've done this incremental way of kind of, first of all, implanting the idea in the mind of researchers with a slight threat that their funding might be at risk if they don't think about it. So this is kind of the stick, if you're talking about a stick and carrot approach. Then by 2017, they started giving dedicated feedback to the researcher about their public involvement plans. So how it can be improved, what they need to think about it, whether they're appropriate, whether they're sufficient. What the HRB also did at this stage was that they had a public panel. So they did an advertising campaign to recruit members of the public to review lay summaries and public and patient involvement plans within research applications. So the next step was to actually give dedicated feedback, not just to the researcher, but actually to the people who make the decisions on funding. Now, that was originally scheduled for 2019. It's been slightly delayed, and the first time they did it was for 2020, it was this year. So the part of the funding application that talked about public and patient involvement directly wasn't scored, but the feedback went to the panel. So if somebody was borderline for getting funding or not, that feedback could be the reason why they did or did not get funded. Now, the plan is that it will be integrated into the scoring criteria. So it's the same way as all other aspects of the funding is scored, it will also be scored. So it will, very much have quite a strong weight as to whether people get funded or not. That is slightly delayed. It's still on the cards, but they haven't integrated it as yet. So if that was the stick, they also at a similar time kind of created what we call the carrot. So what they did was they had 5 awards of just under €350,000 each. And these were called the PPI Ignite Awards. And what they went out to 5 different universities with a healthcare research aspect in it. And that was designed to actually start embedding public and patient involvement and the training that you would need for researchers to have that right in at the university level. So each of the 5 awards focused on a different aspect of it, but it started to bring the community into the universities, the university researchers out into the community as well. So it started to build up those networks. Now, what they've just released this year, and we're still waiting to hear who had it, was a national PPI network. So this is a much bigger funding pot, but it's a single funding pot to build national capacity for public and patient involvement throughout Ireland. So this is a particularly interesting and exciting kind of network that they're building, but it still remains to see, first of all, we don't know who has been awarded the funding yet, and also how it will progress. But it's good to see that they are continuing with it. Another facilitator that really helped was the Health Research Charities Ireland, which is a group of different medical research charities in Ireland who've come together to network together. And they produced things like a PPI toolkit. They also produced a guidance document on supporting patient and public involvement in industry-led research. So these are looking at the same time as the researchers were getting this kind of training and resources put into them, the medical charity groups were also putting in a lot of emphasis and resources into training the advocacy and charity community as well. So it's really kind of come to a good storm together. Horizon Europe is another thing that will help facilitate it. So Horizon Europe is the next stage of funding, the next EU Research and Innovation Programme from 2021. And that will filter down to all national funders as well. So what they're doing, in addition to reinforcing openness, part of their policy is also to create more impact through citizen involvement, and that would include patient involvement. And that's across all of their missions. So they've really doubled down on citizen engagement. Now, in saying that, we talked about a lot of the facilitators that have happened. We have to beware of painting the roses red, because in reality, a lot of the feedback that researchers who do engage in PPI, some of the feedback they get, especially if they're more junior, is that they can actually be considered as being distracted. So by spending more time engaging with the public and trying to implement true PPI, it means that they have more time away, for example, from the lab. So that is considered, actually can be considered by some people as a negative. It's also frequently not part of the tenure or academic framework for promotion. So these are some of the things that really need to change if we're going to truly embed it. So how do we move beyond tokenism? How do we actually allow patient involvement, not just to say, aren't we great, we're involving patients in our research, but how do we actually make it have an impact in improving our research so that it really then has a tangible impact on people living with the diseases that are being researched? You know, how does it translate to that? So we need to think about a wider academic sea change. You know, researchers wear many hats. So sometimes as a patient who's looking to be involved, or a patient group, you need to be vocal and you need to be assured of what you want. So start to think about what your goals are, okay? What are your goals as a patient charity or as a patient? What are your expectations from being involved? You need to think about what your terms are for being involved. And if the researchers that you're involved with aren't meeting those terms, are you willing to walk away? Because sometimes if you want to get past the tokenism, you have to play hardball. You know, a lot of the time, these funding and in the way it's going more, it's reliant on patient involvement. So you do have a degree of power in your hat. You can say no if what you've been promised isn't being delivered on, okay? So when you are yourself are looking at getting involved with a researcher, are you being listened to? What are your plans if your expectations aren't met? And if you're engaging with a research group, you can write these down and say, these are my terms of engagement. So I'm very conscious that we're short on time, okay? So I'm just going to say, what is it that you, if you're getting involved in, are you happy to supplement the existing system that's there? Or are you looking to disrupt the existing system? The first is more likely. We're working towards the second. So there's a lot of talk around the different types of decision making. And in the interest of time, I'm not going to spend too much time on this. This is just going to be our final slide. At the moment, what we tend to have, traditionally what we would have had what's known as a technocratic approach. Experts would have made decisions and those decisions would have been basically told to the public. We've moved towards this decisionist approach whereby, again, the upstream part of those decisions, what is being researched, is still usually decided by, you know, experts. But there might be some kind of consideration for social, economic, cultural considerations. But really what we're moving towards and what we want to move towards is this more deliberative approach where actually there's engagement at the very earliest stage in all the decision making. There's a lot of talk about deliberative processes. In truth, very few processes are truly deliberative, but this is what we're trying to move towards. And if you take anything away from this presentation, is that you need to make sure that you are respected. And sometimes that might mean that you need to be firm in your handling. A lot of the times, if you're engaging with researchers and you're not happy about it, you need to be vocal and tell them. A lot of the time it may just be pure oversight because there are so many other things going on. But if you're not being listened to, you need to have a plan in place to walk away and to consider putting your needs and your expectations on a par with the needs and expectations of the researchers, and being very clear about your expectations at the start and having whoever you're engaging with agree to those and then follow up upon them. So I'm going to skip to the very end because time is ticking away, just to say that if anybody wants to contact me or follow up, I'm always very happy to hear from anybody. So thank you very much. And I look forward to hearing from you. Thanks.